On May 14, 1993, a 19-year-old marathon runner was driving through the New Mexico desert when he suddenly pulled over, gasping for air. He was a competitive athlete in peak physical condition, yet by the time he reached the emergency room, his lungs were rapidly filling with fluid. Despite maximum resuscitative efforts, he died in the emergency department from acute respiratory failure. The young man had been traveling to attend a funeral. It was for his 21-year-old fiancée, who had died just days earlier from the exact same symptoms. This double tragedy was the first sign of an unknown pathogen striking down previously healthy people with terrifying speed. The deaths were centered in the Four Corners region, a rural expanse where the borders of Utah, Colorado, Arizona, and New Mexico intersect. As investigators reviewed local records, they discovered a cluster of similar unexplained deaths from the preceding months. They initially screened for a new strain of influenza or exposure to environmental toxins. With no clear cause and a rising death toll, local officials recognized they were facing a completely unrecognized pathogen and called the CDC for emergency assistance. The CDC team performed genetic sequencing on tissue from the victims. The results showed cross-reactivity with a family of viruses rarely seen in the Western Hemisphere. This resulted in Hantavirus Pulmonary Syndrome. While the virus's identity was now clear, its method of transmission remained a mystery. Investigators still didn't know how the virus was entering the human population. To find the reservoir, the CDC trapped and tested thousands of rodents at the homes and workplaces of the victims. The carrier was the common deer mouse. These rodents carry the hantavirus naturally, shedding it in their waste without showing any signs of illness themselves. This chart shows how an El Niño winter triggered the outbreak. Extreme rainfall led to a surge in vegetation and food, causing the local deer mouse population to grow 10 times larger than the previous year. As the mice moved into human dwellings, the risk became airborne. When rodent urine and droppings dry, any disturbance, like sweeping a floor, stirs the viral particles into the air. The victims weren't interacting with exotic wildlife, they were simply cleaning their homes and cabins, breathing in dust that had become contaminated. While the Sin Nombre strain in North America requires contact with rodents, a South American variant called the Andes virus has developed a more concerning trait. It can spread directly between humans. In May 2026, this capability was demonstrated during an outbreak aboard a cruise ship off the coast of Africa, where the virus spread among passengers in an enclosed environment. The concern for health officials is the incubation period, which can last up to 8 weeks. A person can be infected in an endemic region and travel across the globe before they ever feel sick. This long asymptomatic window explains why health organizations are increasing surveillance ahead of the 2026 World Cup. Millions of travelers will be arriving in North American host cities from regions in South America where the Andes virus is endemic. Increased global travel has shifted hantavirus from a localized environmental risk to an international surveillance priority. More than 30 years after its discovery, there is still no specific antiviral treatment and no licensed vaccine for hantavirus. The mortality rate for those who develop pulmonary symptoms is 40%. When the lungs begin to fail, the only option is intensive supportive care. This often requires an ECMO machine, which takes over the work of the lungs by oxygenating the blood outside the body. Because modern medicine cannot yet cure the infection, our primary defense is environmental management and prevention. The most important prevention rule is to never dry sweep or vacuum areas with rodent activity. This instantly lofts the virus into the air. Instead, you must first ventilate the space for 30 minutes. Any droppings or nesting materials should be thoroughly soaked in a disinfectant or a 10% bleach solution to kill the virus before they are cleaned up. Safe cleanup also requires protective gear. While gloves protect the hands, proper respiratory protection is the most important barrier against airborne particles. The 1993 outbreak showed how a change in the environment can create a sudden human crisis. Staying safe requires us to apply what we've learned, reducing rodent contact, using proper cleaning protocols, and remaining vigilant about shared spaces.